Good day, everyone, and welcome to my presentation. I am here to solicit advocation for the use of mobile health clinics in the Champaign County and surrounding areas. I personally know of two mobile health clinics. One is sponsored by the Carl Foundation Hospital, and the other one by the Champaign County Public Health District. Personally, I am here to advocate for the use of mobile health clinics in providing assistance and help and resources for those of our aging populations in underserved areas in this county. What seems to be the issue? Well, many circumstances contribute to the health disparities that exist among our aging population. Aging adults often suffer from chronic illnesses which need consistent management and care. Barriers such as physical limitations, transportation, and finances keep many of our aging citizens from the health care they so desperately need. Those living in rural areas are just a few of those standing in need of this urgent type of service. Mobile health clinics minimize localization and transportational restrictions that aging adult populations often fall privy to. Who is generally affected by this limited access? Well, many demographics of people are affected by inadequate health service for a variety of reasons. American Hospital and Healthcare Management stated in an article written by Kate Williamson that to overcome the challenges of senior health care, therefore it is need to make major health policy and reforms, making health care more available and affordable, enhancing Medicare's funding and supporting services to assist with long care, and some of the measures that should be taken so the seniors are able to get the required care needed. Also, measures like investing in healthcare technology can make healthcare more accessible for seniors, especially those in rural areas and those who are already struggling to see a doctor. The concept of mobile health clinics fits perfectly under this umbrella. What existing policies do we have already? Well, in 2018, the Carl Medical Facility in Champaign County launched a mobile health clinic to serve those in the surrounding area. The Champaign Public Health District's Wellness on Wheels program is a mobile outreach program that projected targeting low income and uninsured populations, including adolescents. Mobile clinics provide a median number of 3,491 visits annually, with more than half of their clients being women and racial ethnic minorities. In 2023, Congress passed the Mobile Health Care Act, which increases the capacity for community health centers to set up mobile health clinics in underserved regions and rural locations, permitting health centers to create new mobile health care delivery sites utilizing money from the new Access Points grant program established. Now you ask, what is the cost to cover these mobile health clinics? Well, I'm glad you asked. The cost of these clinics depend heavily upon philanthropy and government funding. Of the 281 clinics reporting on their sources, 52 reported philanthropic support, 45% reported federal funding. Health insurance companies also provide much of the funding. 38% reported revenue from public insurance providers and 37% reported funding from from private insurance providers. 32% of clinics reported client payments as sources of revenue. The cost associated with a mobile health care clinic may vary widely based on several factors, which include staffing, services that you provide, and the type of vehicle you utilize. Here are some key points to consider. The annual average operating cost of a mobile health clinic is approximately $275,000. Family van cost, if that's what you're wanting to utilize, is approximately $500,000 annually, which includes personnel, fuel, maintenance, and supplies. The initial investment would be your vehicle purchase and customization, which can run anywhere from $50,000 to $120,000. Salaries for your staff average anywhere from $40,000 base to as high as $100,000 per year per employee. These costs can fluctuate based on specific services that you offer and the volume of patients that you service. Now, who are the key players benefiting from a mobile health clinic? Well, of course, the major beneficiary would be aging adults residing in underserved and underprivileged communities. State and local health departments, healthcare professionals and organizations, community organizations, and of course, policy formulators, legislators, and local government. Data research and case studies that support my policy that I'm advocating for. A study on the effectiveness of mobile health clinics revealed that the significant impact that they have on the health of older adults is tremendous. For example, a systematic narrative analysis by Cruz, Molesky, and Marino in 2017 highlighted how mobile health solutions can improve access to care for our aging populations. The study results show that mobile health clinics allow for older adults to receive vaccines, yearly exams, and facilitate ongoing management of chronic conditions such as hypertension and diabetes. The provision of these services in underserved and underprivileged communities help to reduce the barriers caused by transportation inadequacies, physical limitations, and financial restraints that aging adults often face, limiting their access to health care. Now, how do we address those who would like to argue against the use of mobile health care clinics? Well, seeking to implement clinics is not without its challenges or limitations. Many say that although mobile health clinics increase healthcare access, they cannot replace the comprehensive care that we normally receive from traditional stationary healthcare facilities. There is a concern that mobile clinics can only provide fragmented care, and particularly for those who require specialized care services or continuous care. In addition, the sustainability of mobile health clinics is dependent upon financing and the allocation of resources, which has been a significant challenge. Many clinics operate with limited budgets and may have difficulty consistently providing a complete spectrum of services, leading to variations in their qualities of care. Well, the conclusion of the matter is ultimately, especially regarding accessibility and equity, the proactive implementation of a mobile health clinic policy promises significant benefits for public health. Inaction has a significant price as well. Mobile health clinics can be a great tool in serving the needs of underserved communities to advance health equality and general population health. In conclusion, I would like for you to consider my policy about specifically providing mobile health clinics for our elderly demographics. Thank you for listening and have a great remainder of your day.